Well, to expand this conversation further, we're now joined here in our Nairobi studio by Dr. Kirtida Acharya. She's an endocrinologist and the National Chair of Diabetes Kenya. Doctor, thank you so much for your time this evening. Now, the theme of this year's Diabetes Day is the family in diabetes. But just explain to us how diabetes is a family affair.
Well, diabetes impacts very widely on the individual as well as the family. There are different types of diabetes. So when diabetes occurs in young children, type 1 diabetes, it can affect the whole family. So sometimes parents or families get devastated when we tell them a young child has diabetes and they need insulin injections, for example. So if a child is unable to inject themselves and the parents have to learn how to inject, it impacts onto them going to school, their activities. So the whole family gets affected. The food habits of the whole family have to change because an example has to be set. Sometimes it's a pregnant woman who's become diabetic during the pregnancy, so that also they're worried about what will happen to the child. It could be an elderly person who has diabetes in the family, so again there's worry about what if they're left alone in the house or the sugar drops. So depending on the individual, there's sometimes it's the breadwinner of the family who's affected, and if they come at a later stage, their kidneys could have failed, they need dialysis. So there's so many aspects. A marriage can get affected if the man has erectile dysfunction, for example, as a complication of diabetes. So they need counseling and help with that complication. So there's so many aspects. It's such a multifaceted, complex condition. So really we need support from the family members. Yeah.
Quite interestingly now, the International Diabetes Federation is saying that there are 15.9 million adults living with diabetes in Africa, but that these numbers will increase more than twofold by 2045. What is driving the increase in the disease?
Before we even talk about what is fueling this epidemic of diabetes, just today, World Diabetes Day, 14 November 2019, the IDF actually announced that the global figures have jumped up to 463 million. And the numbers in Africa actually 19 million, and that is a gross underestimate because most countries don't have national diabetes registers. And for every person out there in Africa, for example, who is known to be diabetic, there are 2 people out there who don't actually know their sugar status. So I'm really imploring everybody, go out there and get to know your sugar status. And for every 2 people who don't know that they have diabetes, there are another 4 or 6 people who have pre-diabetes, because type 2 diabetes, the commonest type of diabetes, is predictable and preventable. The factors that are fueling this epidemic, we have extinguishers for them as well. So we need to look at what's causing and then what we can do about it. Unhealthy diets. I don't like the word diet because the first 3 letters are die, but unhealthy food, food habits, fatty foods, starchy foods, fried foods, processed foods. A lot of us are just opening, things and from packets or putting them in microwaves and eating them. We need to really go back to the drawing board and see what we can do, how our ancestors are eating. We are so blessed with fresh fruits and vegetables, but we export them instead of consuming them ourselves. Alcohol, smoking, drinks which are full of sugar. We really need to see if we can drink more water, drink more milk, yogurt. Sedentary lifestyles, the chair is a big culprit. Use the chair for exercise, use the lifts at work, play games, don't play football on your gadgets. Actually take a ball and play with your family and bond with your family. The theme is family. People are forgetting that elderly in the villages. Mental issues, stress. Children are stressed in school, people are stressed at work, economic burdens. We need to get away, we need stress busters.
So Doctor, the things you're talking about now are essentially the changes that individuals can make on a personal level.
Yes.
But what do you think needs to happen when it comes to treatment? Do you think that there's a weakness in government policies when it comes to treatment, when it comes to access perhaps, and also helping those that have diabetes to stick to a treatment regimen?
I think in every weakness or every challenge, there's an opportunity. I don't think we should look at blame games here, whether it's an individual, a society, a community, or the government. Diabetes doesn't belong to the government or the Ministry of Health. It's everybody's personal responsibility. Like I said earlier in the program, diabetes is predictable and preventable. Every little baby step we take and we keep it sustained. Each of us sitting here today watching this program is a potential type 2 diabetic. So we can do something to turn it around. For those who are already living with diabetes, there are programs for patients, there are support groups for patients. The Ministry of Health has really made strides. We have a national diabetes prevention program, we have our national diabetes guidelines and strategy, we have an NCD program that's active. Kenya has been one of the first countries between the IDF, International Diabetes Federation, Diabetes Kenya, Sanofi, and the Ministry of Health. We launched a training program in June this year, and it's almost coming to completion, where 2,000 doctors and clinical officers were trained online. And this is really high standard caliber training, where in all the 47 counties, doctors and clinical officers have been trained to look after patients living with diabetes, and they've been certified by doing an exam. So I think we're the first country in Africa to have had that high caliber training. So the government and all the other partners are really making steps to improve the standards of care we provide. But at the same time, sometimes patients get confused by fake WhatsApp messages where they're getting mixed messages. Some self-professed doctors and nutritionists and quacks out there telling patients the wrong messages. My message is patients should empower themselves. They should get the right information. They should learn self-management. They should at least get a glucometer to know their sugar levels. And if the doctor tells them, or the healthcare practitioner tells them that they need to take ABCD medication, they should comply and adhere to that medical advice.
We will have to leave it there, but thank you so much, Doctor. That was very informative indeed.